Dear one, in this video, I'm going to explain the Soma breathwork method that we will be using in this course. So in a simplistic and easy to understand tutorial, I would like to introduce you to the Soma method. There are 3 easy steps, and I will go into deeper detail on all these steps. Number 1 is rhythmical breathing. Number 2 is holding the breath on the exhale, so without any air in your lungs, an empty retention, or also called abaya kumbhaka. And number 3 is holding on the inhale, so a full retention. Your lungs are full of air, or also called an antara kumbhaka. So let me get into more detail of step number 1. What you need to know. Rhythmical breathing. It is important to take circular breaths. What do I mean by circular breaths? There is no pauses in between the inhale and the exhale. Like an ocean wave never stops. Smooth and silky breaths. The breath too should flow without interruption or struggles. Okay? It is important to breathe into the lower lobes of the lungs. So this means your belly is sinking and moving outward on the inhale, and it is retracting and recoiling towards the spine on the exhale. So no reverse breathing here. The shoulders should have little part in breathing, which means if they are moving towards the ears a lot on the inhale, it is a sign that you might be breathing too much into the higher lobes of your lungs. The left the left lung has 2 lobes because it has created a little bit of space for the heart, which is 2 ticks to the left. And then the breath should be 5-dimensional, not 2-dimensional. The lungs are actually like balloons that are inflating. For a lot of people, it seems like the lungs are flat. And the capacity to breathe is only used in a forward motion, forgetting about all the other directions where the lungs are expanding. So you can test this for yourself by placing one hand over your abdomen and one hand over your chest. So without interfering with the breath, be available to receive the movements of the breath and notice which hand is moving first. There is no right or wrong here. But the ideal is for the hand on the belly to move out first and then the hand on the chest. And for them to move equally but at a different time, if that makes sense. Step number 2, we come to the breath hold. Holding on the exhale. Few things here that are really important to notice. You want to empty your lungs as much as possible on this exhale, while understanding that there will always be a little bit of residual air inside the alveoli and bronchioles. Otherwise, the lungs will collapse and they cannot inflate after they are completely collapsed. So you also do not want to empty your lungs in a forceful way. Something that helps me is to look at my epiglottis. If the epiglottis is still relaxed, or if it's pulling way too much in, that creates a lot of tension, which will inhibit the duration of your breath hold time here. As you empty the lungs, also drop the chin towards the chest. If seated, if you're lying down, this is not necessary. You can just lie down and relax. And then the next important thing, this exhale hold is not a doing, it is an allowing. So you have to allow yourself to be here and surrender here. On a physical aspect, from a scientific point of view, this is the space where the body should be able to sustain a breath hold the longest. as it is not the increase in, or as it is the increase in carbon dioxide that sends the signal to take your next breath. And it is not actually the dropping of oxygen as you would think. However, this exhale goes into the metric system of the mental realm and the limiting beliefs about not being good enough influences the physical body rate of how long it can hold the breath. All of these thoughts create panic because this is the mind's attempt to get your attention, to keep you inside of your comfort zone and to breathe again. The body doesn't talk in language, but rather it talks in sensations and in feelings. So once the body is in hypoxia, you will be able to experience this. The body will communicate with you. It is different for everyone, but in a really subtle yet undeniable way, you will be able to differentiate. Override the urge to breathe for as long as you can. If you have to take a short sip of air, do not fill your lungs completely. And be sure to blow all the air back out and surrender again. After the exhale hold, we come to number 3, holding on the inhale. So when inhaling through the nose, gracefully fill your lungs to about 80 to 90%, leaving a little room for the gas exchanges to expand the lungs for the last little 10%. Hold the breath for about 30 seconds to 1 minute while pulling your mula bandha. Please see the article on demystifying the bandhas, explaining how to do this if you are not familiar with pulling the mula bandha or pelvic floor muscles. You can also pull the tip of your tongue to the soft palate in the back of your mouth, and behind closed eyes, look towards your third eye. The eyes move the gaze up, but you are not per se trying to focus and see something there. Still with me? For those that are visual, colors might appear, or even a white light, or nothing at all. There is no one fit. So when you come back to normal breathing, it is a good indication if you pushed yourself into a forceful hold by noticing if you're grasping for air after this breath hold. From the very first breath after the breath hold, it should be smooth, deep, and graceful breathing. And that's it. 3 easy steps for this method. Looking forward to breathe together.